So I would like to start with a statement saying that talking about mental health is not attention seeking. It is okay to talk about it. Literally speaking, every individual, that is 7.5 billion population of the world,
I can't hear you.
faces some kind
Justin.
of mental issues, but don't talk about it. You can sound confident and yet have anxiety. You can look healthy and yet be weak within. You can look happy and be miserable inside. You can be good looking and still feel ugly. Please be kind because every person is fighting a battle you know nothing about. Good evening and welcome to this webinar where we shall talk about mental health. I am Justin Anthony, your host for the webinar. It is extremely important to talk about mental health issues because it is an enemy that is present everywhere yet invisible. We bring to you speakers and experts from various fields who in their daily lives work with individuals and groups trying to help them cope with their mental issues in one way or the other. As the issue we are discussing today is both complex and grave, we have within us six personalities who will help us understand these issues in depth and provide us with ways to deal with them. Ms. Husna Karania, who is also our keynote speaker for the day, she is a consultant, specialist, optometrist, NHS Hospital, United Kingdom. She is a philanthropist and provides her voluntary support to a charity called Second Sight. Second Sight is actively working in Bihar. She has extensively traveled the length and breadth of Bihar and have touched the lives of millions through her counseling. Welcome to this webinar, ma'am. So now, wasting no more time, to get the webinar going, let me now call upon Ms. Husna Karania, the keynote speaker of today's webinar, to give her presentation and open the stage for discussion. Ms. Husna Karania, ma'am.
Thank you to the Noble Citizen Foundation for inviting me on this webinar, especially to Justin, who is a good friend and the chairman of the foundation. Thank you very much so kindly for allowing me to present on your webinar today. Good evening, India. आप सबको मेरा नमस्कार है. Okay, so I would like to begin today's webinar by saying that I have no financial disclosures to make, first of all. And let me also say that I am no expert in this field. However, my aim today is to try and give you a broad overview on the subject of mental health as I understand it and in the way that we see it here in United Kingdom. What I shall present is just a broad overview of the subject and start it off as an introduction so that you can carry on the discussion during the course of this webinar. It is probably best to start, the best way to start is with a definition of mental health. So what do we really mean when we say mental health? The World Health Organization defines mental health as a state of well being in which every individual realizes his or her own potential and is able to cope with the normal strains and stresses of life, and is able to work productively and fruitfully, and is able to make a contribution to his or her community. So we can say that mental health is a level of our psychological well being or an absence of mental illness. Mental health is an integral and essential component of our overall health. And we need to be rethinking what it means to remain emotionally and mentally balanced, both in our home environment and our workplace. When people are not properly trained or educated to manage emotions, then emotional turbulences can lead to negative health consequences. However, we must remember that every turbulence does not mean that there is a health or a mental illness. So, as we said, just like our physical health, we also have our mental health, which include our feelings, our emotions, and our moods. We have to be careful not to confuse mental health and mental disorder. I agree, there is some overlap, but there is also a very fine line, as they are not exactly the same thing. Mental, good mental health is part of our overall well being. However, if we don't keep it in check, then a mild deviation from this to its extreme can lead to a mental health disorder or a mental illness. And we know of many mental health disorders, for example, anxiety, depression, stress, to name just but a few. Most of what is grouped or lumped together under this label of mental health is actually a state of our emotional well being. And emotional well being requires us to develop the ability to change how we feel whenever we want to avoid going into a negative pattern of negative thinking. So let's talk about mental health in India. See, mental health remains a taboo all across the globe, and particularly so in India within the Indian culture. There are many challenges that the people of India face regarding mental health and the stigma attached to it. India has a population of over 1 billion citizens. And in India, mental health is seen as a disability whereby those with a mental illness are discriminated against. The World Health Organization conducted a study in 2015 when they found that 1 in 5 Indians may suffer from depression in their lifetime. This is equivalent to 200 million people. And overall, India accounts for nearly 15% of the global mental disorder burden. I'm sure most of you from India know this already, that in 2015, a very famous Bollywood actress set up a foundation, a charitable foundation, the TLLF Foundation. Its aim was to create an awareness and a dialogue around mental health and reduce the stigma attached with it. The Live Life Love Laugh Foundation conducted a national survey to perceive what India thinks about mental health. This was done in 2017 and 18, and they concluded that only 10 to 12% of people in India seek help. In other words, 90% of people don't come forward for help. So we now look at London or England, where I'm based. And it is probably fair to say that UK is not without its own issues when it comes to mental health. We are fortunate that our government set about to set the No Health Without Mental Health strategy in February 2011. We know that there are approximately 1 in 4 people in the United Kingdom who experience a mental health problem every year. And the common ones are anxiety and depression. The UK government, in order to address the issue of mental health, has set shared objectives to improve people's mental health and well-being by improving services for everyone and the access to it. Therefore, we are lucky that we have mental health care services are free for everyone here on the National Health Service. In addition to this, each year we have a National Awareness Week, which starts on the second Monday in May. And during this time, both at a local and national level, various events take place to raise awareness of mental health. The key pieces of legislation to support this are the Mental Health Act of 1983 and later updated in 2007. This act covers the assessment, the treatment, and the rights of the people with a mental health disorder. And this is further supported by the Mental Capacity Act of 2005, which is designed to protect and empower people who may not be able to make some decisions for themselves. And there are various charities, such as Mind and ManCap, who work constantly in the background to raise this awareness and support people with mental health illnesses. I, as a healthcare professional working in a NHS hospital, come across patients with mental health issues all the time in my daily life. And we have to have mandatory training in mental health to follow the national guidelines in how we deal with this. So mental health awareness is really important. And we need to understand why mental health is becoming a major concern. It is a well-known fact that, particularly in India, the youth of India are increasingly becoming affected by mental health problems. And the most at-risk group of people are those aged between 18 and 25 years old. And I have read that particularly females more than males. And we need to ask why. Poor state of mental health can lead to increased rate of suicides, which we have seen time and time again. So it is really important to raise the awareness of mental health and recognize the signs. What should we all be doing? It is really important to talk about mental health, and this cannot be overstressed. It's a very difficult and sensitive subject to discuss openly because of the stigma attached to it. However, it is imperative that to move the discussion forward to the forefront of all conversation topics and have transparent discussions on how we feel. And it should be acceptable in this 21st century to talk openly about mental health. It is extremely crucial to express our negative emotions with others on a daily basis. What sort of signs should we look out for? I have taken this infograph from the Australian site Health Direct, and it shows us the 9 key signs which point to a person having mental health issues. And it could be somebody who is close to you and that you love. Feelings of being anxious or worried, feeling depressed or unhappy, having emotional outbursts, sleeping problems, weight loss or weight gain, and changes in our appetite and diet, feeling quiet or withdrawn, drug abuse, eating disorders, feeling guilty or worthless, and having changes in our behavior or our feelings. So talking about your feelings can help you to stay in good mental state and deal with times when you do feel troubled. What are some key simple things, simple ways that we can look after our mental health on a daily basis? By simply keeping active, exercising, meditating, practicing yoga, prayers, eating well and drinking sensibly, keeping in touch with your friends and family at all times, and asking for help when you think you're overburdened with your work or your studies. Taking a break when everything seems overwhelming and pressurized. It is not wrong to just take a break. And very often, to do something that you're good at that makes you feel good about yourself. But above all, it is very important to accept who you are as you are. And also of a duty to care for others and reach out to others who need our help. In conclusion, I would like to say that mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. Therefore, it is extremely important that we all come together as societies and communities to promote and protect good mental health for all individuals all over the world. And I think it is fair to end on this note and say that each and every one of us faces, has experienced, or will experience some mental health issues during our lives. It is how we deal with them that is key. Thank you all for listening.